First, I'm going to start by washing my hands. And I'll identify my patient with 2 patient identifiers, if I had not already done so. Can you tell me your name, please, and your date of birth? Thank you. So then I'll explain the procedure to my patient. My name is Megan, and today I'm going to be cleaning your trach. If at any point during the procedure you feel uncomfortable or have any distress, just raise your hand and I will stop. So I'm going to assess my patient. After I've listened to my patient's lung sounds, I'm going to check their O2 sat monitor on their finger and ensure that their oxygen levels are above 95%. If they were not above 92%, then I would have to hyperoxygenate. Afterwards, I'm going to go ahead and drape my client. Then I'm going to get my equipment ready. I'm going to put on my mask. And then I'm going to wash my hands again. I'm going to open up my Trach care kit and remove my sterile gloves. I will take the drape or the sterile drape that is in my container, and using strict aseptic technique, I will only touch the borders, the 1-inch border, and I will place my drape shiny side down. Then I will take my container and I will empty the contents of my container onto my sterile field. I will then take my normal saline and put it in each compartment. If my patient had an infection, I would use hydrogen peroxide, but they do not today, so I'm just going to go ahead and put that out of the way, and I'm going to use my normal saline. Since this bottle's already been opened, I'm going to ensure that it is not expired, and I'm going to lip it before I pour into each compartment. Okay. Now, I will go ahead and put on some clean gloves. And I will remove my patient's inner cannula. I'm going to move the oxygen collar out of the way for now, stabilize, twist, and pull the inner cannula straight out. Then I will take it and I will drop it into the biggest container of my tray. Then I will take off my clean gloves and I will put on my sterile gloves, and I will arrange the items on my sterile field and get ready to clean this cannula. sort the items on my sterile field and separate them and place them as I need them. I'm going to start by taking my brush and picking up my cannula, and while keeping the cannula directly over the tray that it was in, I will brush off the incrustations on the cannula on the outside and on the inside, making sure that any crustaceans fall into this tray. And afterwards, I will rinse it. And I will take it while stabilizing the flange again and insert it and lock it into place. After that has been done, I will remove this soiled split dressing, and I will take my gauze and I will dip it into the tray that has not been used. And I will take my gauze and I will clean around the stoma of my patient in one sweeping motion. Both on the top and the bottom and all the way around, assessing for any signs of infection or redness or anything such as that. Then I'll take my little Q-tips and I will use them and put them in the same that I had stuck my gauze in, and use them to come and clean further, making one swipe with each Q-tip. After that's been completed, I will reassess my patient . And also check their oxygen saturation. And since they're okay, I'm going to go ahead and I'm going to apply a new trach collar and the new split dressing, remaining aseptic technique. And make sure to put this equally on each side. Making sure that I keep at least a finger's width underneath. And if it's loose, I can tighten it. I may need to do a little bit. And I'll reapply the oxygen collar. After ensuring that my patient is still okay, the O2 sats look fine, and they have no complaints, I will clean up my area, and then I will document the date, time, procedure, how the patient tolerated it, and the patient's vital signs. Then I will take off my these contaminated gloves, apply new clean gloves, to take off my mask and my gown, and to finish cleaning my area.